So if someone's saying that something's blatantly, obviously untrue, or something's blatantly true, I think it's quite easy to differentiate. It's all of these kind of complicated grey areas that tends to be, I feel, where all of these kind of the more charlatans tend to proliferate.
Social media obviously is absolutely everywhere right now, and anyone from a very young kid right up to my granny will have some account on some form of platform. I wanted to start by just talking about where you think the role influencers have in the health and well-being conversation, because I follow a number of people who are very, very popular and might look a certain way, but they may give health advice, specifically nutrition advice, training advice, even medical advice, without any qualifications whatsoever. And I'm seeing a lot of people kind of say, yes, but I saw this on social, rather than listening to tried and tested sources such as their doctor. How big a trend is this in your opinion? And if it is a big trend, how concerned are you by it?
Well, I mean, I kind of feel that, I may be slightly older, so I can remember the world before the internet. And things did certainly seem to be very simple then, I feel. It seemed to be, you'd sort of switch on the TV and you'd watch, kind of early morning TV, and there'd be a doctor on there and you'd listen to advice. You'd go to the library, maybe get some textbooks. I remember those kind of encyclopedia things, that used to have like A to Z of health kind of stuff that you used to kind of get. And then occasionally you'd have like advice and stuff in magazines, and that was pretty much all you got. So in a way, it was very simple and straightforward, and you could kind of trust that kind of medical advice pretty much that you got, because it had gone through lots of various filters beforehand, it had gone through editors, etc., etc. Obviously now things are incredibly different, and partly that is actually a good thing, because years ago it was hard sometimes for people to get information, particularly information that maybe medical professionals for whatever reason deemed they didn't want to give out or deemed not appropriate. So kind of things like around sexual health, for example, kind of people from different minorities and stuff would often find it quite hard to access good information around health, and certainly that has been democratized, as people say. So now we've got kind of lots and lots of information. I would argue, though, we've probably got too much information now, and it's almost impossible, I think, without a medical degree, and even sometimes with a medical degree, to negotiate your way around what's true, what's untrue. And actually, I think there's a whole grey area, which is what makes things even harder. That, for example, I see on social media quite a lot references to a study, whatever that might be. And actually it feels like it's very authentic, it feels like it's trustworthy. And people will often use that as evidence to kind of back up their claims or what they're saying. And then actually when you look at the study, it was maybe done in mice, or it's done in a sample size of 20, or even it was, it looks ostensibly, it looks like quite a good study, but when you sort of drill down in it, you kind of realize, well, maybe the methodology isn't quite as good as it could have been. Maybe there's other what we call confounding factors, other influences that might have affected the result. Now that takes firstly a lot of time it's almost impossible to do that for all of the claims that you see on the internet, and also requires a level of kind of statistical competence that I think the average person doesn't have and shouldn't be expected to have. And even I sometimes, having done statistics at degree level, even I sometimes sort of sit there and think, actually, I'm still not quite sure. Is that real or not real? Is that true? That's kind of flying in the face of everything I've ever been taught, but it sort of seems true. And so it becomes incredibly difficult, I think, for lay members of the public to kind of to negotiate this new world. And I don't blame people for kind of at all for getting kind of sucked into maybe sort of these slightly spurious claims, kind of slightly hysterical kind of responses. And also I think that part of the problem is that doctors have been very slow to get on board with social media. Right. And actually the doctors we see now that tend to have a very big profile on social media tend to be incredibly junior.
Right.
And actually, not to criticize them, I think they have that's what I'm going to criticize them. They've got a very important role to play in engaging with young people. But actually, I see a lot of people, for example, claiming to be mental health experts. And you look at their CV and they've been a doctor for 2.5 years and they've done 3 months in psychiatry. Okay. And I think, well, actually, that's very different to, say, a professor of psychiatry or professor of mental health who's maybe got 40 years of experience, who can kind of stand back, who's got a much sort of a much clearer understanding of that world. And I see this a lot around lots of the kind of more slightly more contentious issues around things like obesity, around things like neurodiversity, ADHD, and so on and so on, where there's almost an encouragement, I think, from actually so often from professionals to kind of, go out and get diagnosed and so on and so on, without actually appreciating maybe the complexity, the social complexity around kind of, what a diagnosis might mean, the impact it's going to have on services, the shifts in diagnostic criteria, for example, like all these other kind of things. And actually it's kind of done under the banner of, we are going to kind of, we need to break down stigma, we need to kind of push, people feeling more comfortable to talk about mental health, actually not realizing the impact that might have further down the line. And actually some of the older doctors, there's a Dr. Iona Heath, there's another doctor, Professor Simon Wesley, former head of the Royal College of Psychiatrists, former head of the Royal Society of Medicine, incredibly eminent doctor. And he's actually said, I'm actually sick of all these mental health campaigns, because all they do is they push worried, well people into seeking a pathology, like a label. And actually that's actually quite unhelpful. It's unhelpful for them, but also it's unhelpful for services that are already at breaking point. And actually that takes, to be able to take that nuanced, complicated perspective, that takes a good few years being on the front line of medicine, understanding kind of, all the complexities around diagnosis. And yet then I see a lot of very junior doctors kind of saying, we need to break down stigma, we need to kind of, make sure that people feel they can talk about their feelings, we need to get them into services and so on, without realizing the impact that might have. So even within the medical profession, I think that certainly some of the more senior doctors have been very wary about getting involved in social media. I think they don't really understand it. They maybe, dare I say, a bit Luddites. They're not quite sure, and a bit like with me, kind of when they were younger, we didn't have the internet, or certainly not as it is now. We certainly don't really understand social media, and also don't really appreciate the impact it has and the power it has. When you think about kind of, say a newspaper or even like, the news, if you talk to a younger person, they don't read newspapers and they don't watch the news. They get their news from TikTok, they get their news from Instagram and so on. And actually I think that the sort of more senior doctors just don't really appreciate that. So even within the medical profession.
So it sounds as though both the older, more experienced doctors and the junior, more kind of tech savvy doctors both have a role to play in this. For instance, the experience of somebody who's been doing it for 40 years, who may not understand the impact that social media has on someone's mind. Well, that knowledge gap can be filled by the younger doctor who's maybe grown up in this world, right? How do you see, again, maybe this is wishful thinking on my part, but how do you see the experience and maybe the younger tech savvy doctors coming together to offer a more, I guess, clear path for people who are genuinely struggling?
Well, I think so. I mean, there's been some really good kind of collaborations between, I think finally, sort of particularly during the pandemic, actually, or as a result of the pandemic, sort of bigger institutions, things like charities, the government, public health bodies, the NHS, has kind of realized, actually, if you want to get sexual health messaging to a 16-year-old, you don't go on the 6 o'clock news.
Yeah.
You do a TikTok about that, or you do a Snapchat or whatever it is. Yeah. And actually, therefore, who are these people? And so I think there's been a much more, who are these people on the platform? And I think it's been a much more, I would say, aggressive kind of reaching out to these people, say, actually, okay, look, this is the message we want to get across. Could you put this on your platform? And much more kind of collaborations, I think. So I think it is starting to happen, but I still think it's incredibly difficult because, well, I suppose there's two reasons. Firstly, it's very hard for the viewer to know how to differentiate between people. Who's a senior doctor, who is being supported by, and who is giving NHS messaging and kind of well-researched, evidence-based recommendations, and actually who has got their PhD, who's saying they're a doctor, but actually they've bought their PhD off the internet. And so the second thing that I think is difficult is that the nature of social media is such that actually we've got very short attention spans, and we have social media set up really to kind of play on that.
Yeah.
And the problem of that is that actually a lot of kind of the good evidence-based messaging is quite boring. It's much better. We're going to be much more engaged with something saying, do you know what, stand on your head and say Barbara Black Sheep 6 times, and you're going to get abs or whatever. We're much more kind of engaged in kind of quirky, unusual, counterintuitive things. That's much more appealing to us than someone saying, do you know what, eat vegetables and fruit, exercise regularly, so on. It's boring messaging. So the problem is social media is geared towards these extremes, I think. And of course, professionals, kind of doctors, nurses, dietitians, etc., are mainly boundaried or kind of bound by key professional requirements. But actually, if you say you're a personal trainer with experience in nutrition, you can say anything you like, really. And there's no formal body that anyone can complain to. There's no real process to kind of get them to, to kind of justify their claims. So actually, the problem is, I think, it's in these the grey areas actually tend to polarize people a lot. So if someone's saying something's blatantly, obviously untrue, or something's blatantly true, I think it's quite easy to differentiate. It's all of these kind of complicated grey areas that tends to be, I feel, where all of these kind of the more charlatans tend to proliferate, and it's very, very difficult to kind of negotiate a way through that. I kind of suspect that probably in the coming years we will see more collaborations between these big organizations and influencers, and also I suspect there will be some kind of process will have to evolve whereby it becomes very obvious who is to be or who's accredited in some way, who's to be believed over those who aren't. We will always get people who are making random statements, who are making spurious claims. It's going to be very hard to police that. But I suspect, a bit like on Twitter with the blue tick thing, there will be some kind of process where you think, do you know what, this person is accountable, is accredited in some way. Again, I still think there'll probably be a lot of grey areas and it'll still be quite complicated, but I think that will help people a bit negotiate through it.